Mas. Mas niya. Como? Kukot? Koi. Kagilama may katamit.
Sa daw kamata. Mata tu mau ibang bungin, tai rere i motor. Tai rere ni tau China ema tau fu. Ka ki motor no koto mi api ako fakatang mamata. Koi ko mu ki tu time ka mu to ela mai ke fakakato. Mo frasi tau ki programa training ko i ahon. Tau kau whataha wugin mo i Tonga'S ma 40 o mai pesa plasi kono whapaanga tau ki training ko ni o whafau mai e pureanga ko Tonga. Ko ke whawa ko tau kau awhonua. Ika i te whakalola ko kore pe tau ki programa ako koe pongpongini ke kamataka tau ki loto. Ako whawhe hena Davina whonua ke ne tapua ki tau ki programa. Mala.
Tolong kau falau kau falau fatu pukau. Oke, fatata mai pupung fafo fakon tamai ka ada famarom fafta tu ngako dalam mahal mui bai. Wa usia ya hoa fafo fakon tamai. Ko waktu mau ilo papau pe tamai ko mau programa ko to ape mau fa ko mau foto tu. Fai e funga tai lo ka ko o to ni mo o fa mau lave mo nua e hoa mo tai mi. O ngā tamai koe awhio mai koe ki polokalama ni o amana ke mawhakaho koe ahon. Ane awhina e na mo polokalama lava lelei lava mawhatongi a lava ke mawako mea ngahi mea lahi ke te tio ke tak ki hawhanonga ko mo tak tāpi. O te hanga atu he pompong fofa koe ni tamai. Koe aho nou ane ki polokalama mau kore a tamai ke te hifo hoke lesi. Mo langlangi ke kau ia te mautore ki polokalama te mawhakaho koe ahon ni. Ka ki mea sisi bukan mea lahi te mau ala ako he ahon tu ke hoko ko haka pasa folau ke mau mo ui mo hoko atu mau ke kore pe ho lelei me langlangi aho ke whakateunga ake pe a Fiona o kore pe ngai lelei ni ke muamu aba ke mui o a po mama hulu whamalmal ke whanonga ka wai mau kore ka tau pe ngai lelei ni wa fasisu klaisi ka ko mau whamo ui amen.
Sai, whamalola hatin ka David a koe koe loto lelei koe a koe te huak ma ki tau tolu koe koe te wakan ki hoko ate tau ki polokalama ako. Pea koe tau hoko atu pe koe ni koe ospe koe ni u awe whaikapare koe ni ka ema tau fui ke hoko ate tau polokalama ako pea koe whamanata taipe ai hoko koe tau ki polokalama tau le ret koe ni whahoko me tau ki tuwha certificate a iwhiawhi. Ka koe wata tai pia talamanunga te kumutol maha wharatola. Koe te waki koe tau wako koe pongpongi ni. Mahalo koe ia pe mahalo.
Sai malo apito pe a tata lelei kumutol pongpongin na mo mak pe ha mo lelei ane po. Anoa ko to ko no ke tol COVID. So it's similar to that as well. So na uila virus ko na niyo. O kung whakatupunga COVID, for novel coronavirus. So spread very, very quickly. I think from what they were saying, this is Chinese New Year. Out of Australia National celebrating our Chinese New Year. So it was a festival going on in China. And when they go back to wherever they came from, they get to announce they get Tonga'S a virus. So they spread. And it's how it spread so quickly, it become a pandemic. Right? It goes everywhere. So it was declared as a pandemic in 2020. There's about 565 million cases in the world, 6.35 million deaths. We are so lucky. Right? So, for comparison here, they said, well, death rate 1.14, in God's grace, we are only 0.1. So, we have to be thankful. The 5 last nations that COVID has come to. So from March, lockdown, 3 weeks, and we've been living with restrictions since then. And COVID has been successfully avoided until February. After how my February. There was one case, 2021, was well contained, then I get a community spread. Got February, war, ne kamata aluke community, Kamata leva itongani a traffic light sign, ngawe ake Ministry of Health, ke tau ngawe ake itongani ke heanga tau nofo and live with COVID. O tau lanha ko dai mini. Lan Mori ko ya big tau lanu green. Lan Mori, but I think a lot of people think that we are green. If you look around when you go to places, nobody's wearing masks, nobody's bothered about the social distance. They think that we are green, but we are not. We are orange. And orange, what does it mean? Orange? Orange of tauke wear mask, especially if you go to an enclosed environment, you wear mask and you keep your distance. Go hard distance? 1.5. If you can do 2 meters, 2 meters. Ngai me ko ke tau whakatoka nga he taimini. O kui kai ko orange means green. Totally different color. Sai o ku fu tu lawe ang ofua au pita fo ke kautonga ko uhi ko e tau NCD non-communicable diseases is very high in Tonga. Pea koe mea o toi whakatu tāmaki ngai ka tau tō. Koe mea I hope you can connect koe uhinga e na tau ura ki tala noa ai ki he mahu inga o health. Did you know about the triangle of health? Ko hono uhinga, koe fight the COVID, mei basi e te mo'ui, tūkunga o e te mo'ui o ku te iai, a e te malawa o tau'i ai COVID. Ko toko au pito, I tongani, ko blood pressure, lahi au pito, pe moe fu'usisi no, heart diseases, and generally poor immunization, immunized systems due to poor diet. Aya koe tau whaunga ma'u mea tokoni. O ikai ke tokoni ia, ken hanga o tau'i, ai taime o tau whaite ai pia moe virus, especially virus. So even more reason to take good care of yourself. Mana tu'i ma'u peho ki foi triangle, keep your triangle balance. Yeah? All right? So you can see why it's important that we talk about health first, because we are dealing with COVID, and COVID is a viral infection. And virus, we will talk more about it as we go along. Virus, o kai ke hawhai to'o ke virus. Ka te tau tok lau pe ki ai. Get immunized, most important thing. Get immunized, and you have a plan. You have a plan of how you will deal with the virus if you ever get it. Sai, ko plan ko ni, you have a personal plan yourself. Pe hangen au mana ki lave pe kia aneafi. In your family, you start with your family. Have a little plan. What's going to happen if one of us is sick? How are we going to isolate that person? How are we going to look after their social needs? How are we going to look after ahono atamai? How are we going to give their food? Kapau te ke kamata pehe I api, ko alu koi ke ngā we, and if you are like Tony, if you have got a business, you have a plan. And at the end of the session of our training today, hopefully we will be able to learn how to do a plan. You guys will be able to have a little plan, a little COVID plan at your house, or even a little personal plan if you're a taxi driver, or if you've got a business like Tony. You have a plan. If anybody is sick with COVID, how do I deal with it? E koe mea lahi ai he taimino ko manatu I pe I he whakaawa koe ni o lotu, taimi koe ni tala mai o whakaawa I lotu. Pe au, I talked to the whaiwhekau hi maukolo, pe o kui ai hawhetu taki me he ofisi o siasi, o kui ai ha palani. Ki he taimi e whoki ai COVID, and I even rang up somebody very reliable person I he siasi, and unfortunately, nake ke ha palani. So what we do, I'm just sharing with you, so what we do at the church, I gather a few of our health workers. You don't wait for somebody from the other village to come and do it. So I went to the whaiwhekau, and we gather all our health workers in our little village, and we make a plan. Ko pau ke mau alu katoa ki ai, ko ha e mau me ai whai, matapā koe, e tu ai toko ua, ko pau ke mau provide a mask, mo sanitizer, pia na mau ai lewa, ko sanitizer, hange whako koe tau, na tau kia neafi, everybody comes in and squirt the sanitizers. And that's a very good way of transmitting around the virus. If somebody's got it, how do you know? Okay, get passed on. So one of us had to stand there at the door and squirt out the sanitizers. Give out, if people don't come with their mask, we have the mask there, we provide them with the mask. So that's what you do when you are ready, and you have to stand up and do it. Don't wait for somebody else to do. We walk the talk. Yeah. Okay. Sai, ko ki kapate mo sio mai ki kalaf ko ni ko angai progress ko atonga aloke taimena hard lockdown ai alke olunga te holo hifo ai ko taimini ko ni kutawa a men ko taimini ni kutawi lalo ni taimini flatten out the taimin, and hopefully we will be able to keep it that way. So the number of daily cases are currently going down, but when borders open, there will be new cases. Even with our screening tools, as I said yesterday, we can't control people that are coming in and what they're bringing in. What can we control? What can we control? We can only control our behavior, ko tau toonga pe ko tau tolu, te tau lava or control, and that's the only thing that we can work on. And then we encourage you, and this is the aim of our training, is that we equip you with knowledge and skills. Ke mo lava o whehangahangai, pia mo kakai ko ni te nau hau. He koe he kai ke tau lava tau tolu ia o ta off ki nau tolu. Pia mahal na hau e pe mo whahinga ia o kai ke nau immunize ki nau tolu. And those are the people that will spread the disease around. Ka ko whanongo pe ko ngahi wakapuna lahi o kunau ikai ke nau whakangofua hataha ke travel without being immunized. So first thing, the lava or prevent COVID-19 is immunization. Immunization, please get your immunization up to date. Koe tau tukunga tau iai he taimini atonga ni, ko new cases, koe nean he aho tahatolu, tahatolu siulai. New cases is 13. Kei tahaua pe mate. Total cases, koe tahamano wa se tupu. Active cases te aua hiva. Pia koe nautole ku recover. Sai koe tau pustae taimini peset pe ni mavalu. Ka mahalo koe whahinga o te kei ke nau tiu. The first dose is 98, second dose is 91. But we all want to do the booster. I've already had my third booster before I came. So at the moment, mahalo pe na to I have fourth booster here. Hopefully and I'll go and do it. I've had the flu vaccine before I came. I had the third vaccine, the booster, and I'm still walking. I haven't grown any extra arms like some people thought. I'm okay. A lot of people are okay with it, and I'm sure que pe ngai whakau aki pe moe vaccination, but I don't think we'll get into that. But we encourage the Ministry of Health that you get your booster done. Hopefully pe mo tolko na te ke lava mo booster. Hopefully pe te mo lava to. O whai mo booster he koe mea ia tene malui lahi koe malui lahi a puke lahi. You might not it might not prevent you from having it. Ka koe te puke lahi o kumalava e he vaccine o tata ofia. Ta koe huinga ia mea tau whaingai ke whai a vaccination. So immunization, our goal is to increase the number of people who receive booster shots. That's the third one, to improve resistance to new variants, forms of COVID-19 virus that are sure to enter Tonga when borders are open. These variants are common now in Australia and New Zealand. Ko o siya umay nga variant ke he. Sai, Variant koko kui Tonga'S is the B1. O siai ngahi variant kehe pati tau toki tala noa o set koe ni ki he natula o virus. Mo ene haku feliuli waki pehe ai. P2, P4, P5, o nau pehe ku lahiang whaingof toe, whaingof fuang, ai pipihi a koe ni, a ngahi variant koe ni. These subvariants show vaccine escape as for B1, but also immune escape from previous infection with other variants and subvariants. And these can get into Tonga. Once the border will open, they will most probably come into Tonga. So and I encourage you to get your booster done. Yeah? If you're due for it, go and get it done. Understanding COVID-19. It's spread by close person-to-person contact and over long distances through respiratory droplets from speaking, coughing, or sneezing. Symptoms may appear 2 to 14 days. Incubation period. Malama pe ke whetaulaki koe pe mo e virus, pe e toki asi ha aho e ua, pe aho e taha wha. Me ho first contact. Pe o ku malawa pe I he taime ni ihi, hange koe lau, ne to taha nei lau ane afi. Koe ke o fuloko o ngoi e nau tolu ha mea, ha symptoms. Ka o ku nau ospuke nau tolu ya. And this is the thing that is very dangerous. Koe taime ni ihi, koe ke te ngoi ke te ha symptoms, but you've already got it. And you go and get tested and you're positive and you think, I don't feel anything. If you are tested positive, please stay home. Ko hui te ke malawa pe koe whaingo fuatahaya a hono tufaki koe o virus. And it can only be detected by laboratory tests and tau o whaihe o CV. Ko me koe whaunga peia e lawa yo iloi, ka pau whai ai test koe ia. O sai he taimini, pe ke te whai ai test koe ni I api, whakatau pe te ki me atesi, and you can do it at home yourself. I remember when I first got here, I went home and my parents are elderly, and there was a girl who has been helping them. And I happened to have a little test kit with me, and I asked her, do you regularly get tested? Because I thought there will be some kind of system because they look after vulnerable people, that they get regularly tested, and they didn't get tested. So I tested her, and guess what? She was positive. And she didn't have any symptoms. But she was, I think, an exposure to somebody who had it. And that's the very dangerous thing, especially they are the most mobile, like your ages. These guys, you are the most mobile population. But you go around, especially your grandparents, and you will give it to them. And it will be very dangerous. So it will be dangerous to them. So that's why it's very important that you get tested, and if you get tested, you're positive, stay home. So I told this girl, you have to go home. And she went home, and she was out for 2 weeks. And she went and get tested again, and she was all right. So it's very important that you get a test done, because you won't know it. You won't know it. And especially I think in the tourism industry, that there is a plan to get the workers regularly tested. And I think we've got business owners here. At the end of the day, ai palani ngā aue koe ke tau COVID prepare, ke iai ha whahinga palani ke tesi ai kau ngā aue. Because sometimes you will not know it. He kai ke ia how symptoms are going. But regular checking, hopefully, if somebody is going around and they've got it, that it will be picked up. Te tau to glau pe kia, e tau sio ki ngahi ki he palani te tau tok sio ki ai anai, Okay. Konga mahu inga eni o ku whemau, mau whemau, and hopefully te mo tokanga ki ai. What is a virus and why can't we just take penicillin? Ke nanga tamatei ai virus. Sai koe CMU, o germs, o kuia e whahinga kalasio CMU, virus, also bacteria, koe me whangi mea atu koe parasites, ka koe mea lai taha o kune whakatupunga, a e tau puke, koe virus, mo bacteria. So, koe CMU, it's all around us every day. Some develop more ability to bring sickness than others. Two types, bacteria and virus. Vailasi, ku tau whakatonga I whakahanga tonu pe me virus o ai pe koe vailasi. Coronavirus, COVID-19 is a virus. Koe COVID, koe vailasi. Virus is much smaller and harder to kill than bacteria. Koe whaunga koe o vailasi, o ku fuuwhainga taa hono tamatei. O ku nau fuui ki ange nau tolu, and sometimes they develop a protection outside themselves. They meni koe whanga ki hukai tua, just koe whainga whaunga koe a virus, it's very, very difficult to kill. And penicillin or antibiotic, penicillin is a type of antibiotic. Lahi ngai whaitau kehe, hingoa kehe, o antibiotic, ko penicillin, ko amoxicillin, ko doxycycline, ngai hingoa kehe, those are all antibiotics. But antibiotics do not kill virus. Ko hi pe koe whotunga, koe whaunga koe virus o whainga taa au pitoia. Sai, koe virus, and this is why we te mo ko whakaampe, ke mo appreciate when we talk about health first. Koe virus, o koe kia treatment nia ki ai. Ko tau sino pe, ko tau sino o koe pe a mea na e whaohe o tua, ko tau sino, ko immunity system. Ko mea peia o kunehanga o fight off a virus. Ko e tau vaccination o whai, o tau hanga whakahu, a vaccination is a weaker type, me similar ki he whahinga virus te puke ai. Ai ka pau hang koe COVID. Ko whonga nau ai koe a vaccination. They injected, it's been injected to us. Te aku recognize lewa ho tau sino o tau tol ai whanki ai vaccination koe ni, and our body build up. Ai whanki sotia malui mo whanonga maupe ai he retio, our body build up, ai whanki sotia malui ke nau iloi koe virus yen, and they attack it. Sai, ko immunity system ho tau sino, ko mea mahu ingai ke tau mo ui lelei. Manatu I whakafoke tau whakaukau ke tau health triangle. Ko mea ia o mahu ingai ke tau mo ui lelei, ke tau lava o fight off a virus. Ko hui he kai ke lava a bacteria, antibiotic ia, o fight off, or kill a virus. So our body fight viruses with our immune system, which requires a balanced diet, to function well. Immunization against virus, can help our immune system fight better. So that's basically why it's very important that we stay healthy. Mana tui mau pe foke ke tau ki triangle o whainga mau pe ke mo ui lele. Ko hui kai lava ho sino o taui ai virus. And it goes across to all the diseases caused by virus. Flu. Ko ngai kaya whainga mahaki o ku mo whanonga pe o ku talatu ko hono ko siemu o ku ne whakatupunga ko virus. Ko mea pe o ku ne hanga o tamatei o ku ne hanga o tene ai koe ke sai ko ho immunity system ke sai. It will just have its course. Ma ko aho me aho tolu aho nima pe osi. Pa hei kai ke lava ia hao alo to mai au ke ho whae o tarangi. Mai ange na to ha foi amoxila hena. Ke mai ange ke u follow. One of the things o ku whe mao ke tau whakakaukau mao pe ki ai he ko ilo pe ko to onga ni tau whai to ngani. Ko ne puke pe taha lagato o mai foi amoxila. Follow. Pak follow ko ia o kai ke follow ia. Ko follow atu pe a taha a hoa mahalo ko taimi pe ko osia e virus ia pe aongo isaia pe tuku ia. Ka ku ke osi follow e koi ai amoxila. It builds up a resistance in your body to amoxicillin. Kaya leva e alupe ai taimi he kai leva ke toi lava ho sino o ko ia kai leva ke toi lava ke aonga ai amoxicillin ia ka koe i ho tau ki ngau ki follow tu taha he puke ko ni puke hoko mai te follow foi a heua o ku kovi au pito ia o ku iloi pe o ku taha ia ngai mea i to ngani ko ki puke pe o ku mai ki foi pneumonia pe ko pneumonia o ku ko ngai fonga pe he o ku build up e hoto sino kita a resistance ki he ke fahinga antibiotic ia ko ia. And when you get very sick you needed that antibiotic, it won't work for you. Don't get that oa te mo anga aki fahinga mea ko ia. And I think the pharmaceutical department he taiminu nau fahinga ke whakamatala ke kakai ke oua ngawe ake ai amoxicillin pe ko whahinga antibiotic i he ai hake pe ki mea follow for antibiotic ai hake pe mea follow for pneumonia koe virus koe mea pe tene hanga o tau e virus is our immunity system more vaccination sai transmission mode pe koe anga e hono tufaki ai ngai whaunga e tufaki aki ai virus COVID-19 close contact person to person aya koe pipihi koe ni ai virus it's through the respiratory fluid pe koe taime o kute any fluid that comes from our respiratory system halanga manava aya koe ha mea ku whainga fluid me he tau halanga manava. Anybody? This table? Ka whainga huhua maha koe koe lea whakalea pia huhua i he tau halanga manava. Hiu pee iyo whawai taime o kuke mawhatua ai ko taime ko mawhatua ai kuke kapate ki mawhatua ko ni mau ku ai hai it's moist there's droplets in there ko ngahi huhu aia o kuni hanga whakamafola ai COVID so ko mea mahuinga ai ko aniafi taime o kuke mawhatua ai pia whewhe ko mawhatua ai o kaki uhinga tau ai peke tau fufan e tau ai pehe but most ko uhinga peke ke mawhatua ki ho ni mai o ka pau kai ki ai hao holo ke mawhatua ki ai COVID-19 spreads primarily from person to person, close contact with some sick people. Ka pau te nau tai, ka pau ke alatu ke ki ai o lakat ko haki ko mea e vavia e teke maua e koia. Tatau pe hanga ko flu ko flu is virus, they spread exactly the same thing Droplets released when someone with COVID-19 sneezes, coughs, spit can land on the mouth or noses of people nearby. Sai koe mawhatua, so koe whai mawhatua koe, whakamanga ngutu ia toko taha koe, koe ne aluat koe ia mawhola e mau e ia. Sai, oku malawa foki, ke mawhola ke me toko taha koe infected, ki he ngahi surface area, hange koe lift, ka pau kia ha lift, koe ngahi fui button koe he lift, Can you imagine, toko taha koe toa peo, alo heka he lifi, oku na tae hano nima, pe alo at lewa ia o press the button. Sai koe tau laptop is also easy way of transmitting the virus. Si ngai devices ko toa koe telefoni, ngai mea koe e malawa ke nofo ai a virus pe a mawhola ai. Sai, tonop ngai wheitu oenu to tonfo koe ke tau aware ko pak mahu inga ai koe ke tau ilo. Tata whitu ke moto koe ni tourism, hange koe ni kau business owners. These are areas that should be cleaned properly because they can transmit the virus. Ko ngahi matapa, toa nope matapa, Everybody that goes in and out, they touch the door. Ko e peni. So if you touch something contaminated and then touch your face, pe ko hoto ihu, ko alue a virus kia koe, So it's very important, hange koe tau, lau koe ane afi, you wear your mask, o te ke toi ala holo, o te ke toi ala. Make it a habit, o te ke toi ala ko mata, o te ke toi ala ko mask, pa ke toi ala ko mata, ngahi o mata. Make sure, o ku, whatai meni ko, make it a habit, ke te punima pe hepe, ke o te toi ala holo. So, e tak tahayai pe ene ki i whaunga, to make yourself be aware o te ke toi ala holo, te ke toi ala holo ko mata, pe te toi ala ki hoto mask. Ko hui, whaunga ia e whaingo fuai e te hangao tufaki holo a pipihi a virus. Ngai whaunga pe o ku transmit a ka COVID-19. Ulu aki, koe ha? Koe ha mea ulu aki e koe, UPE. UPE, a elewa ka paulewa te ke whanghoihu i he tissue pe aha. Go straight to the bin, Owe toi tuku i hata whaaki pe toi whaoi ke kato, If you, after you blow into your tissue or your, on the tissue, discard it. And if it's a handkerchief, make sure you put it away, pe ke alu o fo, Penga le ke fo. Tika no wa, it's when you sneeze, So symptoms morphe, ya whahinga morphe, Vai whahinga iau koe ke nau morphe nau tō. Langa ulu, body ache, Langa tua kia, langa tua, ngahi symptoms iau tala mai he whahinga koe, o kunau nau puke koe he COVID, o kunau mau, ka pau nau mau. Pea ko hono, whakamui, langa kete, taimeni ihi, diarrhea, gastrointestinal symptoms. Ka ki tātai taha, ka koe ngahi common symptoms e i mua, Whewhek mau tolu kona na e puke COVID, ko na kai ke fumea ko ia,
Whether I get it or not.
Kana ki whakesi e me tōtu i ti?
No, ala pesi, tamai posti, they took another swab, ke alo PCR, and tamai ko alo rote at tato ki tutake ang They got to king na tutake ang nato. Pako taro ito mai, ito di upo ke na, ito na nato, take as a swab, ito posti.
So, kung meron ko talaga
But that bring in the customer service,
communication,
and just the customer service. Au unahan na to, may gawe unnecessary stress, no just kaya, kung family, kung kaumami, at kung tanawa, kung kaumaya. Pero it's customer service.
It's very important, eh? Que tau mo ui in general, eh? Pea como ngawe ko ni customer service, it's very important that you do communicate, eh? Taha ngai mea na ako iki mautolo he ako i high school. Na wako pehene high school pe auto ke alu. Ka ku ke ala fai hatala. Te toi foki mai, te ke foki mai o tala mai fekau, pena e hai fekau, eh? Te ka fai maha fekau e hatiuta pa te alu. Pakai ke te foki mai, o stohi mo ua kita. Eh? So communication is a process, eh? Pau ka fai ata me ka ku ke fai ha ue, eh? Te hange ko ni ka pau ko to o ha toto, te ku to o ha si, eh? You have to get back to the person and tell them. And I think that's a very ko taha ya ngai me aya I Tongan, especially mahalo ke he Ministry of Health, eh? And I think mahalo na au ke fui taimia ko ya mahalo they were overwhelmed, I think, at time. But that's not a good excuse. But no excuse, exactly. It's not an excuse. Eh? Que fire communication, especially when it's results of any test that you have, it should be communicated back. After, yeah. So ko osang ko yaya ta ko ku he. Mahu inga upito ke communicate really well, eh? Pea ko tui pe mahala te mo lava o te mo lava pe o ngawe aki ai ko example lele upito ki he communication, eh? Especially when it's your health. We're sorry, eh? Okay. Oh. Okay, ngai me pena tau lau kia, eh? Okay. So, ngahi symptoms pe mo mafatua, helaia, loss of smell. I think ko mea na ki makehe ake ai COVID-19 me he normal flu, loss of smell. And when it gets worse, no manava. Ka iai hataimi ko au hataha ku COVID positive o no ene manava o stoton leo ke whakaofiof ki whare mahaki. Kai mo ke tāki whare mahaki. Ke whai hasio ka koe. Especially, ka pau o kuiai ha whahinga toi mahaki NCTs, tatu ke kau vai, pe o ku iai ha nau puke he hela, especially, tata te whito if you have any respiratory disease, previous respiratory disease, hela, whaapuke he bronchitis, bronchiolitis, hango kauleka, bronchiolitis, very common he kauleka, pia moe asthma, ka paulewa ko au o nau au e nau puke, o au o nau no e nau manawa, o staton ke whainga o alu whare mahaki. Taha ngai common symptoms ke mamahe monga. And these are more symptoms. So mild symptoms, kapawa mild symptoms pe lava pe manage pe ai api, yeah? If it gets worse, continue isolating and consider telehealth or nurse line. I think ko nas ngawa pe tongan, yeah? Telefone ke line nei whare mahaki o kole whare I ka nautol. Pea na kake fulele, you're on the system on the phone for so long, eh? Oku ikai ko tongani pe I must admit, ia mautolu I Australiana la pito kakai nautolu na positive, Pea na koe system koe ai na pau ke to tā mai e kauto ke tā, na pe system ke me hanga pe koe ni, ke nau tā ki he tā mai kauto ke tā, o check ke kau maha ki, But lahi to lahi na ke to lawan kauto ke tā mai, and they were just overwhelmed. Hey, na fu lahi au pito pe ngā wea ka nau tō kai ke nau te lawan na tōru get back. So Tonga is not different, but I know it's no excuse, but we're dealing with pandemic. Pea ko konga lahi pe kakai, they just isolate themselves at home, try and look after themselves. You drink plenty of water, Panadol and ibuprofen if you have any, ke whilanga ki, and just rest. Severe symptoms, ango glauko ane nai, ka pau lewa e au o COVID ho manawa, no ho manawa, pea ke whainga lewa ke whai mo ke alwhare mahaki, A pau e au mamahi ho whatawhata, to a stage you confused, delirious, pea ku hangeo kai ke toi on ho whakakau, o ku savia, o ku toton leo ke whai mo ke whainga, ke alwhare mahaki, o ke if to come see you, ka palawa hao ha toke tā, pe hao ha nesi o hao sio ka koe sayang e ko hiki o te ke toi alwhare mahaki, Inability to wake up or stay awake, or bluish in the lips or face. Ai ko ngahi whakailonga o fukovi au pito ho manawa. Ka pau te whakatoka ngai ataha ko kamata ke lanu pulu e longutu ia o whangai whakatapu. Ko uhinga ia o fukovi au pito ne manawa kai ke ia o oxygen ia ke ia o ki henu longutu. One of the signs, whai mo ke whainga whakatoto, o tā rewa, ko haka tau whika iheni. 911, 911 ko e ambulance ia. O ilo e mea, 911, whika au taton ke ma uia he o toa pe, emergency number, o taton ke ma ui loto he toko taha ko toa pe. O ko matatu e ko friend na e puke he ngawe pea tāngia kia te au pea tā mai ki ai o matala no tarang stay on the line, get somebody to ring the emergency number. Pea tā mai ea ko uiat ko ke toko taha ke alo tā ko ke ilo toko taha ea ko ia I fika emergency number. So an emergency number in any country, wherever you go, learn it by heart. 911 i heni. Ko mautolo 000 i Australia. If you go to America, you have to learn the emergency number. Ko hi kai ai hataimi ko ke whainga tā i ai, Kai kia hatahe to tokoni at ka koe, pau ke tā ke whika ko ia. So, make it an effort, ke hanga tohi a emergency number. Pe hanga ko ngahi business, you should have the emergency number, hospital number, or the fire at your place, if you're a business. Sai, koe prevention lewa eni ki he COVID, Ulo aki humalui, Humalui, whanawhano, te tau. Hopefully pe te mo alu pe ko me heni ko mo osi ma o pito mo ata mai a me ko fano pe pena to ton pe ke tau kamata pe ko he tau session na to ton pe ke tau sanitize o tau nima and make it a habit when you go to work, when you go in ke alu ke nga away, there's a sink there hopefully, and if there's no sink there, a sanitizer, wash your hands. Wash your hands before you start working. Paka ke alot lewa ke ho tesi, alat ko tesi, wipe it down. These are the basic hygiene, and if you make it a habit for yourself, you've got more chances that you will prevent getting any COVID, getting any flu, or getting any type of viruses or bacteria disease that is going around. But make it a habit, whanawhano. tui e mask, tui e mask, pea tui I he whaunga totonu, Mana tui hange ko glau koe aneafi, be aware, ko whewhe tu o kuke iai. If you're in an enclosed environment, we always wear the mask. If you're at a high-risk area, ka pau ke alu ki whare mahaki, ke alu or visit someone, if you've got an N95, put it on. Ko hite ki alu ke wheitu, o kulahi ai ka kai kehe, moe ngahi mahaki kehe. Be aware. Maupe, koe taimi koe ni, koe ki toi taimi ia, ke tau ke tau ai noa ia. We are dealing with our lives and you have to look after yourself. That is the only way that you can look after the other people. You look after yourself first. Prevent you from spreading out any virus, and you prevent yourself from getting anything from the other person next to you. Sneeze or coughing, sneeze into a tissue or onto your elbow. Tau he wā mamao. Kau manatui nau alatu ki pangke, o whai ki ai me ai. Pea kou tuui mua, pea kou oku os whakailonga pe whoke, kau ke alatu lewa, oku os whakailonga mea o whai ai e tuu, pea ke tuu ai. Pea au tuu au e mea kou whakailonga, tō taha hoko mai, toi unu mai ia. So I started to move a little bit. O toi unu mai pe tō taha koe. Pea au talangi lewa, ka taki mua au ki tuu, pe tuu pe whakailonga koe mea. So don't be shy. O te ke mā. O te ke mā, it's your life. Ko tui pe e sai pe ke kakai ka. Kai whai pe I he whaunga lelei pe. O te ke tawhaka pe koe, un mama. I katake ange koe mea ena kone uswakailonga mai pe ke tau tu uai. So, tau he wā mama o, ngahi whaunga pe ni, e tau lava prevent ai, tau puke, pe koe mawhola ai COVID-19. Sai, oa e ala ki hongutu, oa e ala ki he mata, pe hange koe tau tui e mask, o te ala holo ki he to mask, pe te toi he koe te ala pe ki he, koe ke te manatu e kita, te ala hakita ko to mata. Stay away from crowded gatherings. Sai. Ko taimit ko tau tofo kautonga ko o ke fai ha mali pe ko ha mea ko tau o fie ilo fai ha birthday ko o ke si o pe ko fala e fiha mo ngatu e fiha mo those are the things ko kai te ton ke tau to whakau kau ki ai ko taimini ngai feitu ko tokolahi tau try and avoid it pa ko ngai taimini so ko taimi ko ne covid ko taimi sai tai te fai ka toanga ko hi toko si ipe, ai pe kita ke toko si, Toko lahi ka kita ke ue whakamore. Tokang kita ke lawa kakai, Ko ngai mea ko kapati te talang pe ko talamai ne covid, talamai ko lawa covid, o ku kai ke to laka toko te au, E no foi loto. Ko se ko save lahi ka kita. So owa al no ai owa al pe ko ofie ilo. If you don't have to be there, stay away. Stay at home. Clean and disinfect high-touch surfaces. Ngai wheitu ko na tau lau kia ane nai, doorknob, koe laptop, koe TV remote control, ngai mea ia uku, pala toko taha ko toa peki ai. At the end of the day, if you make it a habit in your house, wipe it down. Te tau tok lawat ki mui, I he ke toki ai whanki mea disinfectant, ke lava peo ngā we aki, hui peo ngā we aki. Stay home and rest should you feel unwell. And we walk that talk, ko Lin, kai ke ngoi le saya Lin, so we're walking the talk, she's staying at home. but she can't be here because she's not feeling well. Eh? So the main message, stay healthy to keep COVID. Our health triangle, always make sure that your triangle is balanced. Eh? Eat healthy, avoid alcohol, eh? And if you have to, maybe just a glass a week or so. Eh? OAF, eh? Quit tobacco, not helping with your respiratory system, AF. Eh? And stay physically active. Tenga maupe ke yai hau ki at least half an hour a day, do a little exercise. Eh? In saying that, stand up. Okay. Oh. Sai, có hay hơn là tên ai hạt tàu kỵ move kì ai. Hả? Easy? Oh, iyo ai hang tàu kỵ foi fácil. Có phải tàu. Have you got any music, eh? Iyo te tàu kỵ exercise tàu đồ loại, eh? I will start off, but each table will come up with a move after this, eh? Okay, just move your hand. Okay, 1. Can you bring it up a little louder? Yes. Both hands. Okay. Next table. This table. A move. New move. Okay, move your foot. Yes. Iyo, sekretariat Pak Tony. Okay, hands up. Okay, this table, Tony, you're gonna move. Oh, easy. Oh, boy, move it easy. Yeah, walk back. Good. Walk front. Back. Oh, okay, the body. Good. Yes. Okay, all right. Side. Okay, malo abito. Okay, can sit down now. Good. Okay. Side. If you feel you want to sanitize your hand, do so. Sai whakafōwhape ho'okai, eh? Whakafōwha maupe ai kai, koe lau ai kau nutritionist, ki he whaunga lere taha, ki he whakaholo e sino, ko 80% is what you eat. 20% is exercise. Ka koe peseti lai taha, o e te whaunga koe ke whenga ea ki ke control o to sino, koe te mea ko kai. So eat in moderation. Fua ake o ko lau he kau nutritionist, your palm of your hand should be your portion. O e ai fu pere tike, hake ia me kai ke tere. Ki kai si pe, whakafuafua mau pe, ki mea kai, carbohydrate, vegetable, pe moe meati. Sayange, ai kai e, ai ka, sayang mo kapai ka ia. Sayange kapai ka he kai sipi. Maa, sio sai ki hoto poketi, toi sai ki hoto sino. Ka koe pango fok ko tau tolu he taimin, ke kai pea me sipi o ngako, ka ifo, Toka nga I mau pe, ho portion, ho kai. He kai ke kaurere ia ke sino, he kai lewa ke lava o tau'i. Ai ngā he mahaki kehe, o kawai pe mo COVID. Wearing a mask shows kindness. Ko o tui koe ho mask, o ku ke ofa, ki ho kaunga api. O ku ne tui hono mask, o ku ofa mai ka te koe. Showing a mask means you're kind to your relatives or you're kind to your friend. So, o te mo ma, he wear a mask, he kou tui foki I he taimini, o fu relax au pito pe a kakai he taimini. Taka pau te tui at kita ha mask, kua ngeku sio I kita ia, pe ku te fie. Ha, nai pe ha. Ka o te mo hange pe koe lau ki mua koe ni he tau, tala noa whika aku pe mo health. Take personal responsibility for your own health. Ko koe pe te ke hanga o malu I koe. Ko koe pe te ke ofa I a koe. Pe o te mutokanga muto ke lau mai kakai o ku ha moha he taimi o ku wear mask. Ko au ke wear mask pe e ku alu ke whale koloa. Even a small shop at my village, ko alu ke ai, ko tui pe au hok mask. Pak mo whatonga tau si aina, se ko nau ngai whale koloa nau tō, o sanga na tolo ai plastic e mea. And nau whale koloa. See, they're very conscious. Nau poto nau tolo. A pau te ke alu ke ha whei tu upe, still wear the mask. Remember, we're still orange, we're not green. We're still orange. So you should wear the mask. My mask protects you, your mask protects me. Mana tui mau pe, ko e tau tui e mask, ko ho ofa ia ki ho kaunga api, ko ho ofa ia ki ho whamiri. Together we can stay safe when we're wearing the mask. That's the best thing we can do. Ko e taime ni I whoke o tau hange ko gloves, whi mau ke kapau ke hao gloves, o ku ke alo whakatau, tuai whainga ni ka pau kia gloves tui. Ka koe mea pe I he gloves, mana tui ho alo o ala holo he mea koe koe whae whakatau, koe osko ia, pia ke te ala hake koe koho mata. Make sure o ku to o gloves. Taimi koe to o gloves, and wearing gloves, o ku ikai ke ne whetongi ia whanwhano. Ko ne ospeho wear gloves, whanawhano nima. O e pehe o ke gloves pa kai ke. Ko ne osma just make it a habit. Ko topeho gloves, still wash your hands. And just a simple reminder, a mask is only effective if you wear it properly. You have the right mask to the place that you're going to. N95, o ka pau kuke alu ki hanga he wheitu, o kuke ilo, it's high risk. If you go to hospital, pau kuke alu ki ha wheitu, kai ke te lava ia ngau e kakai ki iai ha space. If you have an N95, wear it. If not, just wear any mask that you've got available. It's still better than nothing. Medical paper, 3 layers or 2 layers. 2-layer fabric with filters. So, one of our girls here, and I congratulate her, na ne kole mask, ke alo tui in the mask. Sit lava pe ai. Pea ko funky mask, ai funky pocket loto, you can put in a paper towel or something with a little filter. So funky mea ko ya lava pe ai. Te lava pe ko ai api. And even that could be a business for yourself. Ke ai o sell it. $5 or $2. E hoko ko ki business ya ko. So ko funky mea ya te mo lava pe o creative he funky mea ko ya, and I'm glad somebody picked that up. Ken tui pe ya ne mask. Pe aska te lava pe ko reuse it for tau. Te ngau aki. 1 layer fabric fashion, it's not good protection, could use cheap paper. So I go mask ka pau ko tui pe, ka sai apito, ka pau kai te it saves you money, ka ai ki pocket I loto, o ai ho ki filter, ai ki a paper towel will do, or another little fabric, you can use it as a mask. Okay, just go over what, keep yourself and others safe, and we all do it, and we can all protect ourselves. Protect yourself and those around you. Get vaccinated as soon as it's your turn, and follow local guidance with the vaccination. Ko tiu peki ho vaccination, please go and get it done, especially your booster. Keep physical distance and at least 1 meter from others, even if they don't appear to be sick. Ko ngahi new normal ni ko te tau o tau afononga ai. Ka tau ka o ke ha feitu feinga pe ke no fu va mama, o atu pe tangu tu pe he tafaki fe piki e no fo ka o fa mai ka ku ata pe ke unu pe ke mo va mama. Pe ka pauleva o ke ilo ko alu ke feitu ya he ke lava keep the distance. Offer my tuiha mask. Whakakau, just be alert all the time. Ko taimieni o kutau ihe mamani ke he taimieni. Pea ko tau tolu pe te tau responsible for it, for our own lives. Be mindful of where you go, and suitable PPEs, ke ngawe aki ki ai, personal protection equipment, that's PPE. Feitu ko ke alu ki ai, whakakau I mau, whakakau lelei mau pe, I mea o te tonu ke prepare yourself ke alu moia ki ngai feitu ko ia. Whaka ke alu lewa o nau fu toko lahi, pia ka pau o ku te tonu ke iai, try and get a mask. Pia ka pau ku kai fia ma o ke iai. Go home. I'll get up and my pet TV, whatever they're doing, it will probably be on live stream. See, you can live stream, it's very good, you can just watch it from home. Wear a proper fitted mask when physical distance is not possible. Also, keep your room ventilated. I api. Whakahawaawa maupe a matapa, ngahi matapa sio ata, whakahawaawa maupe. And clean your hands frequently with alcohol-based hand rub or soap and water. Whano maupe. And cover your mouth and nose with a bent elbow or tissue when you cough or sneeze, and dispose of used tissues immediately and clean your hands regularly. Ka paulewa ku ke mafatua ke honima sometimes o tuai te a koto elbow ke mafatua ke honima. O whamai ospe pa ke whanawhano. Ugeha ki ha sanitizer ai ngau e aki. Ko hui ko ke ilo e taimeni ngalo ia koe ka ke ala ko mata. Pe te alat koia o tae atu kaunga api high five at ki ai. Just be mindful. I think that's one of the key things that we need you to take home. Be mindful of where you're going, where you are, and how you can prevent any transmission of the virus among wherever you are. If you develop symptoms or test positive for COVID-19, self-isolate. You self-isolate until you're tested negative or until you don't have any symptoms. Mahal ko taimini, isolate pe until you feel okay. Pe ke tok foki lewa ke ngau pe ko ha mea ton ke foki ki ai. Okay. Whamanatu pe whaunga to tonu, tau whanwhano, So, manatu I mau be ai whanawhano. Se kone whiha? Se kone whanoa, se kone whanoa. At least se kone whanoa, Paka paulewa kai ke loko lava manatu e se kone whanoa. Just sing to yourself in your head. You don't have to sing it out. Happy birthday, Happy birthday twice. And you should be able, you should be okay. Okay. We'll talk about surface cleaning, Mako elian aonga lahi kia motolu I he ngawe kon he tourism. Clean all surfaces with soap, detergent to remove the dirt and reduce the virus. Sai kaya ha whahinga o kunau tenau ngawe cleaner or because even when you are working at the as receptionist, inga whaitu kon go get the ngawe ai I tourism, mahu inga au pito, did you clean the surface that you work on? Initially, when you get there, make it a habit. Clean the area. As I said before, ko surfaces, tahaya ngahi mea, o kumalawa ke alo a virus ke apipi ki ai, and the next person come along, touch it, they can get it. Disinfect high-use area. I have to clean. The soap and water will remove the virus. Disinfectant in high-use area will disinfect, will kill the virus. So, koe ki iheni, I tongani ma ngofu apita seniola, Koe ki mea ante ke lava peo ngahi I api, ke disinfect ak ho ngahi equipment at home. Ai koe genola, 10 mils, genola or bleach. You can put in 500 mils or a liter of water. And that is enough to disinfect any surfaces. Sai, kapau koe ngau ake nima will dry up your hand. Kai ke ngau ake disinfectant or ke sanitizer. It's to disinfect any surfaces. Most genola in Tonga is 4.5%, so it's sodium hypochlorite. Koe ke mkare e loto koe I he genola. Aia koe ki formula aia te lava ngawe aki I api ke hanga disinfect aki ho surfaces. And you can put it in one of these sprays. You can buy this, I think it's a Chinese shop. Ki spray bottle, you can put your liquid inside and you can just spray. Use it for your spray and then wipe it on the surfaces. On the doors, on all your computer, you can use it on that. And you can just use the rag. Ngai ko ngā whangi kongonga tupenupe, you can use it. Ka pau kia ha paper towel, that's even better. You can throw it away. But if not, go for expensive, you can just use a rag. Old clothes, cut it up, ngawe akia, and make sure you wash it. Ospuga ta avaleval. Ko hono fufulu koi o surface, ko whima pe ke mo be aware of that. Ka pau lewa ku ke tau te whito ki he ngahi whare kai, Nau tolku na ko ngawe he whare kai. Ko taimeni ku te sio at ke hono clean koe mea ko ne laka me petu. What are you doing? You're just removing this into there, into there, into there. Ko te hiki pe me he, te oatu ki he, oatu ki he. You have to do it in a way, he kai te oatu, te hanga pe o move around the viruses there. And usually you do it in a circular motion, or te go over twice any area that you've already touched. I got the spray, you spray it. I like just doing it in circular motion. And usually you go, go from that area first, most dirty. So most likely koloto, so you start from the middle. Don't go twice over any surface. So you go circular, go oskidua, oskidua. Over a meak the certain time in the Farakai, go laka mai pe go at atungai. You're just moving around the virus there. Do it in a way that you think do it once. Once you just touch the surface once and go over to another surface. If you've got paper towel, throw it in the bin. Paper towel, you rinse it before you go to the next table. With the same cloth. Change. Same cloth. Go and rinse it, please. One of the basin, rinse, then you go to the next table. That's the way you're sure you're not taking anything else from this table. Ammonia, I think ko isi na eke neafi, fika up me ammonia whether it will kill the virus, and apparently not. Ammonia isi, you can't use it here. It won't kill the virus. What time? 11. Okay. When to clean and when to disinfect. Clean with products containing soap or detergent. It reduces the germs or the surfaces by removing contaminants and decreases risk of infection from surfaces. Mauinga au pito ngawe aki oikoa because it removes the germs. If no one with confirmed or suspected COVID-19 has been in a space, cleaning once a day is usually enough. Ka pau ku kai kia tahai ku mo pe o puke pe ko either flu pe ko COVID, ka pau te clean a surface ko ya once a day, that's enough. Ang ko api sai au pito pe ya. Kapag ko ngahi area, hangekon ko tourism ya ha kakai ke he ya kiai, ha kakai ke, and you don't know who's got what, so you have to clean regularly, especially hangeko ngahi fare kai, hangeko ngahi motele, ko pau ke clean ko after every person finish using the motel, you have to clean afterwards. Disinfecting kills any remaining germs or surfaces which further reduces any risk of spread infection. Ai ko tau ko mea tau to disinfect just to make sure it kills any remaining virus or bacteria that's on the surface. When you clean it with soap and water, it will remove what's there, but it will certainly be killed off if you use the disinfectant. Ai ko ngai high risk area, recommended you disinfect it. Ngai fetu kon I tak mamata, recommended you clean and you disinfect. Ko api ka pau ku kai ke yai hat disinfect soap and water. Te unga pe. You may want to either clean more frequently or choose to disinfect in addition to cleaning in shared spaces if the space is a high traffic area with a large number of people, if it's poorly ventilated, or if it does not provide access to hand washing or hand sanitizer, or if it's occupied by people at increased risk for severe illnesses from COVID-19. Ngai fetu kon ha ko fale mahaki mo ngai fetu ko paupe ke nau frequently clean and also disinfect. Fale mahaki te ton ke nau all the time they should be cleaning. If a sick person or someone who tested positive for COVID-19 has been in your facility within the last 24 hours, you should clean and disinfect the space. Ako mea mahui ngai nia ke kau business owner ngai feitu ko ni ngai feitu o ku tali anga kakai ke yai ha te palani e taimi ka yai ha taha COVID o ku he te facility, what do you do afterwards? Tony and Isi, sorry I'll put you on the spot. Do you guys have any protocol, COVID protocol in your facility at the moment? Ikai? Don't worry. Tony, have you got any COVID protocol in your place?
I'm told to hear what you're saying. When you're talking normal, when you shout in, tell everyone.
Okay. So I
don't know when you're talking to me because I see you know.
Have you got a COVID protocol in your facility? Have you got a COVID protocol? COVID protocol in your
No, I've not
guest
got
house?
any paperwork on it,
Okay,
no.
all right.
I'm expecting we'll get that from Visitors Bureau.
Okay. Okay. Mahu inga au pito ni Tata te fito ka wea ha te ki business. Pa ko tu pe mahal fo ko me ani a Ministry of Health. They should have a policy ke ngai feitu ko ni tata te fito ke ngai That's what I.
But for us, yes, we can get a
So the in our COVID protocol. But what the point is, if you have got a business, especially in the tourism industry, you should have, or try and have, and hopefully this will help you today. By the end of our training, that you'll be able to think about having a little protocol, and you can get help from the Ministry of Health. You can ring up and ask them, I need somebody, can somebody come and help me do my protocol, COVID protocol. And I think they should be able, how did you do yours?
The Ministry of Health doesn't do that. The business owner has to their own protocol, and then they will come into assessment.
Okay. Okay. So but what I'm trying to get at, if you don't know how to do it, hopefully we will help you today. I can't see any reason why no one can come and give you a hand. Business, any facility. Oh, there you go. According to your facility, yeah. I have in our guideline, my guideline, go through it, and then you have to do it yourself, because you have to gear it to your whatever facility you've got. Because the taxi driver, because a guest house, because apiako, and even the church. And that's why I thought I think, I'm not quite sure, that every church, the main big churches, should have their protocol, and then give it out to smaller branches. Okay, see, I still got protocol, they have a temperature checked. But hopefully by the end of our training, you'll be strong enough and have enough knowledge to put a little protocol for yourself. And you can think about it. If you think small, kamata pegi mesisi, kapag taxi driver, ko ha eku ki palani, COVID, ke malu iau, pe mo eku customer hatai me hawai, te tau toki lau kiai I he tau at the end of the day, hopefully to equip you all guys with the courage. Once you get all this knowledge of how the viruses is spread, and also the policy, the government policy, they should indicate ngahi business ngahi guideline ka konu tamai okape guideline pela valeva ngahi fangi business muy pe ai ka ko pau pe ke hanga o formulated according to your whatever facility you've got. Ko me taha I he ko hange ko ni I he ngahi feitu hange ko ko fale mahaki pe mo ko tui pe mahalo pe hepe mo ngahi feitu ko ni hotel mo me ko ya hange ko na tol ko no kunau tau he kau isolate kau folau eva mai kau folau ko tai mini ko na ngahi fonga ko mo ngahi me ngau ko ke ngawe aki pau pe ke na ngau ke disinfectant ka ko kia te au mo ngai whakau ki he tourism industry. Ka pau lewa ko ngahi hotele, ngahi guest house. Ko taimi ko nau aluai ko a kau guest. You have to do a very good, thorough clean afterwards. So you have to know ko tau disinfectant. And this is, and I'm sorry that I pick on the two business owners here, but you have to know a percentage or alcohol disinfectant go ke ngawe aki. Make sure fiha fitnoa, 70% alcohol, and that's the good disinfectant. Ke ngawe aki ia, ngawe aki he te kau ngawe. Make sure oku iai e nau N95, ke nau whai ake cleaning. Make sure oku ai ha nau gown, ke nau ngawe aki. Ngai responsibility pehe, ko tui o to tonu ke aware ki ai tourism industry, and especially if you've got a facility like a hotel, a motel, or a guest house. It will be the owner's responsibility, and the worker's responsibility is to make sure that you ask your owner, do I have this? Do you have this? Do you have that? Pea hui ke whai ake ngāwe. And I'm pretty sure ka pau e whi tanganoa aki, whi ngāwe aki pehe, a kau ngāwe ko i he tourism industry, Tonga will be prepared. We'll be well prepared when we open up. Kai owa e taimeni ihi o kutau ilo peta tole mea kutoton ke whai, kau kai ke whai ia. So if you are a worker, mana tui mau pe, you're going to go home. You have to protect yourself. It's your responsibility. That's your responsibility. It's your responsibility to ask the owner. O kuiai ha mea pehe, o kuiai ha mea pehe, ke ngāwe aki, ke lawa whai ngāwe. Pea ka pau o kui kai, pea e ngāwe lewa e o nā ki ai, o kumi mai mea ko ia, ke available, ke taimi o ko whai ai cleaning up. Okay. O kulawa I COVID o mo ui a ngahi aho I he umea o ke ala ki ai. Kai lava ai whakamaa tama te ia. Sai, o ku I he whakamatala koe put ngai mo ui, viruses can be on the surface, they can live there for up to 72 hours on surfaces. Aia ko mea ia ku ka pau e omia uvaka folau mai koni u koloa, they're usually in quarantine for 3 days. Make sure o ku ikai ke te ia ha virus, if something was picked up, ikai ke te mo ui after 3 days. Whakamaa mo ngawe ake mea tamat siemu, koe sanitizer I api e ngai mea o whaala ke ai kakai, hange koe doorknob, hange koe remote control, mea ka mose mama, u mea lomi remote, u te pile ngawe, u telefoni, tablet, laptop, fufulu mau peho ni ma o kawai mo taimi, te ke au ki api, te hei osi ho o whao, ai whakau, te ngahi mea kehe ki mua, pea ke toki kaile. Whano. Mana tui mau pea ke whano, au ke alat ki api, osi ho so pingi, osi ho alat o ala, takai holo hi ngahi. He shelf, ka pau ka sanitizer immediately afterwards. And when you get home, put your stuff, unload all your stuff into your cupboards, wash your hands. Make sure you wash your hands. So washing your hands will save you. Okay, where are we now? Okay. Sai, ki mua pa tau. Ko tau ki scenario en, te tau ki ngawe whakulupue. You got a co-worker who is non-compliant with workplace protocols and teases you for your compliance. How do you handle them? Ka pau ki ai ha o tau ngā ue a koe, o ku ke au ni hangaia o whakamatalili I koe, he taimi o ku ke peku lawa tua ka koe, he taimi ko o ku ke tui ai ho mask. Sai, tau kulupe e ua, ai koe whai scenario ulo aki, aia he te pile koe, pea moe. So you've got a co-worker, he's non-compliant with your workplace protocols, and he teases you for your compliance. How do you deal with it? The other tables, 1, 2, 3 there, tourists or clients who won't follow COVID prevention protocol. How do you handle that? Sai mo ngau fa kulupu ka os patau toki talanoa lewa ki ai, eh? So 2 scenarios, your table, that table and this table are going to do the same. Yeah. No, separate. So you 3 just discuss it, you 3 discuss it, and these 2 they discuss it. Eh? They mo and you come up with whatever you come up with, that's your own way of doing it. But you do the same one. Eh? And the other 3, you do the second scenarios, eh? Mahino? Mahino pe? Iyo. Uluaki pe mo tolo, taha ua tolo, koe ua, te pile koe moe. Eh? Ka te mo taktaha ai pe ene mea hane te pile, eh? How are you going? I forgot to call him.
whanongo he tue, mo e whakalawe tala, he ai manu launo e, hoku toli he kakala, to ahono mausa, pea te ki he sola o taka. No fope I he, hao tangata, ko whanongo he tue, mo e whakalawe tala, he ai manu launo e, hoku toli he kakala, to ahono mausa, pea te ki he sola o taka. Hei longa ho o fifili, ka te o whakamatala, ko mau e tui, ki hapota tala. Hei longa ho o fifili, ka te o whakamatala, ko mau e tui, ki hapota tala.
Yeah, Mao? Okay. So we'll go through starting from this table. I got scenario Y. Tourists or a client who won't follow COVID prevention protocol. How do you handle it? Manatui, mo was faithful customer service training with Linda. Yeah? So bring in all your communications into it and we'll talk about it. Yeah? Okay, this table.
Malo pide mafanga mali pako ko anga ko mau discuss me mau kulupu ke fo nga ko te mau fai ka pau he ke talango fua ka pau ke loto e ka follow e vaya ke now follow ke COVID prevention protocol ai te mau lo pe ke mau talange ke kapau ke na fema na toria ke kapau te mau talange ke tui e mask pe ke na fietui e lava pe ke mau talange ke fangofua ke isolate kai e lava ke Ke mautalange e ke lava ke hoko ate ne whanonga mo I kuna tau mua koe o amanake ne ngā tau mua o ku aruki ai o ka pahe ke ne tuia masa ke lava ya malo ko ia pe malo.
Okay, malo Aupito. So we'll all go through for grupo koe e tolu for scenario tatau, and then we'll discuss it afterwards. Eh? So next table, Sai Aupito.
Malo e mau whinga maari e. O bato na mau tue tātana pe mau tolu ki he scenario ua. Kai e mau tātana ko ki ai ko pehe ko e tourism. O ke client who work solo the COVID prevention protocol. Ko uhinga le vai ko e mau ki uhinga ko ka mau tau he mau tātana noa. Tau pehe ko kau fulau e wa ko nau. O mai ko ki Tonga'S pe aku I kai ke nau fie mui. O kai ke nau fie whakahoko e prevention. Hange ko e alau ko ki he COVID tahi wa. Ke huhu malu I tau laki me laki pe ke huhu malu I. O tau he wa mama o mo tui mau pe mea malu I. Ka pau lewa o ko kai ke ne fie whakahoko e ia e tutu ni ko o ku toton ke ngai aki ki COVID e me lewa hoko te hanga ia whaka mafola to lahi yange COVID o ka pau o ku hau kai ke tau ilo tope o COVID he kai ke whetui ia e mea malu I ke malu I ia o malu e toko taha ko amana ke nau wheo takai holo ko he ne folau mai ko ai ku pe mau tope ke kau betul mau fano he fia mau betul tahu he wa mama o aku me mau inga ke tu ye me malu I ko ai ko e me le vai hoko tente hang ia increase o to lah yang ai case ko o e COVID ta hiwa o ka pau he kai ke fe mui ki he tu ni ko ai ke COVID ta hiwa malo ko ia pe ko ni me lava to konya.
Okay.
Malo Aupito, aki tatana te ke mena mau tana ke mau kulupu. Aya whekau aki ni mau ke hai mea te mau whai ki hai. Tau pehe ki ha kesi peka taha hau ke mau accommodation ka pau kai ke mui ke prevention protocol ko ni mau whao. Ta whatata pe amanakan ke te wawa ko pota. Mau osi mau lewa mau ki whare tau pehe ko mau ki whare no whtotongi e mau protokolo ko ke mu hau kau ke sio mui tau pehe mau osi whabibiki lewa mau usaini ke wear mask all the time e kau ke si ai time te nau check in ya e te mau whahino e pe mau lao ke nau mui ki ai mau expect that ke nau mui mai ki he ke ngahi mea ko mau talange ko ngā ko si ofia hao mo e malu e mau kau staff mo nau ngahi family ai ko whiri whawhoi tui pia nau tolu ko he mau whakaukat mo toni ke he mau ngāwe ko mau I kai lao ke he u whare o ku wha talanoa I pe hange ka au ka holo mo mea te whakatokanga kaku kata mai tau si ngau e kan me tak mata hek mau sa kau pe mau ke get rid ka pa hek ke nau talango fua pa tu pat lewa ke kum ha fe tu te nau nga ke sio ka ke lava pe ke mau ke hoko ate mau ki fare ta te mau puke ka ta pun pe puke ai mau ngai family ka kloia ka ma pe he pe he ta ha ko ma tal tali ka kai e fai pe ha ki talanoa pa ka pau pe kai ke talango fua pe tangi si me atua
Sai malo Aupito malo Aupito sai Aupito ngai tari ko na mo omai me mawinga mo omai he mea ko e fetala no aki ulu aki ko e clear a protocol you have to have a protocol Pea follow the protocol ko ia, and a clear guideline of the consequences. Ka pau he kai ke follow I he instruction, ani ko a protocol ko he mau facility. These are the consequences. Ka pau lewa ko hange ko ni ka pau ko takitua. Say ko takitua ko ke fie tui maske a toko taha tourist ya. Hange ko whakamatala me mui ura ki tala noa. Mut ura ki tala noa ki ho tourist ai toi whakamanatu ki ai risk ko open the border ko ke mau ilo ko ha mo mea mo ha mo ya kai ke mau ilo mau to ko mea peni o mau ilo ko pau pe ke ta wear mask, I wear mask, you wear mask, and we are protecting each other. Discussion pau pe ke fai have pe po tala noa and a clear guidelines of the consequences if this is what's happening. If you still refuse to do it, pea ko mea le vai ne hoko hange ko mea ko nuku o tala mai kautama ko me mui give them the options ko mea ai hoko koe moe or ka pau lewa ko ke flatly refuse e malama pe ke mau toi tali e mau tol koe ki heni or pe hange ko kau o mi koe o eva ka pau lewa kai ke toi o kai pe ke fie tu ia koe ho mask e malama ka pau ai lewa ki o supervisor pass it on no ke ilo ko hai to malungang ke lava o tala noa ki ai te ha ata options, so give them the options hanga options ko lava ke fai pe ka pau lewa pe ko kai this is the ultimatum he kai ke to lava ko fa mole kai ke to lava ko o alu he tua kai koloa ke clear, you have a clear guideline of what's going to happen if they don't follow the protocols that you've got installed. Pea mahalo ko ngai mea lahi au toton ke fai mo ave one of your when you're advertising if you're advertising your guest house or these are one of the things. We are COVID, we are trying to keep everybody free from COVID. These are the rules that you have to follow. So give them time to think about it before they get here. Ka ku fa time fo ke ni tau fe ma ke na wo mai. Pa ka pa le te na wa mai pe fa ile mo oangi he na wa mai pe. Ki fo da ko tu ko ho fanki u me ko pa mo guess put it in there. At least they see it, and if anything happens, they've got it there. You've done your part. Kausai au pito, discuss it first with them, give them the options, other options if possible. Kapau ko fahinga me au ko te lava or pass on to your higher supervisor, please do so. Ke na te lava to koni mai if there's other options. If not, ko ha consequences o ko ke fotu I ho protocol, be strong enough to follow it. Te ha mea te whietanak maha taha?
I ta whaakoni business whakatak mamata. Koe ulua ki whetuutaki koe pa moi client. O hoko ia he kotoa moi me kotoa o ngahi accommodation. I tongani o nau online booking.
Online, yeah.
Mahino pe koe airlinea te ko the highest safety alert. Koe industry ku o malunga apito e nau safety pe security. Os mahino e fo mai e palangia patoga mai ki tongani. Ka koe first point of contact ai businessi pa my client o fire he online booking platform. I online booking platform he time ko fa o he to ta businessi ene framatala ko information ko ke tuku atu I he online platform o kai reservation policy and conditions. Ai mahu inga ke os whakakau e te COVID prevention protocol I he konga o whamatala ko ia. Ke lau he e toko taha he customer, pe ko client. Ke mua pe agree ke ne whili no anga ko ia ke nofo ai. Pea I he tanaki pe ko ngā koe ki whanawa ko hiri koe ene whili koe ai accommodation ke nofo ai. Taimi ko whaia transaction. Pe ku totonga ki te po city online pe o mai ene credit card ke hold ake reservation. They are automatically going into a legal
agreement.
Yes.
Yes. Yeah.
So time ko ya mai ki tongani again it's ke tau ke follow ko mai ki tongani ko pa ko tau to briefing pe upon check-in I he u lao I protocol ko ini. And of course mau inga ke whakahu mo ia I he information pack o tuku e uloki nofo anga kai pehe ha posters all around the places to keep reminding them ko hai mea toton ke nau whakahuko. Pea ka nau I kai leo ke nau comply o ku os mahinu pe ka nau tole mea hoko. Aia ku pou ko toa peke ngai tali ka ko ki whakama opo atu pe to be friendly pe kai ke tau tea I nau tolu I whaunga o te e whaapa. O ku hanga e he communication koe ni o support e tau decision he kos mahino pe o ku mahu inga pe ana os agree e ne tali ke nofo e tau nofo anga whakate fito ke information koe na ane mahu.
Moni au pito
Oia pe malo.
Moni au pito e malo au pito e tanaki mai ko ia, and it is very true nowadays. A lot of the stuff, a lot of the bookings are online. Aia ka pate ke alu ho information ko ia online. Pe hange ko mea ko na lau mai se tila. Ko time pe nau tali ai, e nau whili ke ho o facility, pe ko nau whili ke nau hau ki tongani, they are legally supposed to be complying to whatever conditions. Ka ku sai au pito pe, I'm reminding, like what she said, ko posters, posters ke ai o post I he upon entering into your facility. Clear ia ngai mea ko whia mau ko ke nau follow. Pea whakamanatu ma pe hanga ko nau o mai pe o smawa te nau ki folder with all the information you want them to have, stick it in there. Ka ku sai au pito tau foi scenario ko ia. Okay, so the next one, you got a co-worker who is non-compliant with workplace protocols and also teases you for your compliance. Okay, and we start with these two.
Nā mā pehe koe, nā tūla pehe ka kaitonga ai mea koe manuki pe koe katakata I koe tango te whingai ke te whahokoha mea kusai. Ka nā mā pehe koe mea pehe ke te rake te whahoko koe te taranoa ke tō taha ko ia pe koe owangane uoningi koe ngā kene iloi. Koe ngā mahalo ke mausia ne ata mai kene whakaukau ke mau inga ai ngā no tui koe maas mo whai koe whano mo mea. Tau te tokoni lewa ke tō tā koe ia I e whawho I e whātānoa kia te ia kene iloi a ngai mau inga koe ai te follow ai protocol ai COVID-19. Pea ka pau e whai tupe kai pe kene whanongo pe kai pe ke whakahakari riwia. Pa te tupe te kita I ai koe ngā ka te whahoko te kita ai tuia ngā te follow te kita protocol. Koe ngā mauinga pe e te mauia te kita. Pa te toki raki whenga ke te tōni kita pa te tok tōni koe ai ni ke. Pa te same time te tōni pe mani ke. Koe a pe malo.
Sai malo. Ka tama koe. Lo.
Ko tui ko e ka hoko ha mea beheni he api ngāwe o kuaha ni ihi au koe ke nau tui ha mas. Ka te tui mas ki te apa e katakata i kita mō mea. Ko i lo i ka pau ko hataha kita ku te ongo i mālohi e te hao mō mālohi api ngāwe mō ofa he ngāwe o ku te ngāwe ai ki hene rei taha. Te maa ki tā mālohi whe unga ke te hangatonu ke toko taha ko iao o tala no hangatonu ki ai. Taimlahi ku tau sio ai ka ni ihu e nau tau hilao mo whakahoko ha mehe ap ngawe. O ku wawe mau peke whakamau i mo ita ke toko taha ko ia. Ka taimi ko koe te nofo whakaukau o mahalo ko toko taha ko e ni ku o keke fuumahino ki ai e tui e mas. Ko hai uhinga te tui e mas. Ka hange ko e ngahi slaiti na tau sio ai he ahoni. O whemau ke te tala noa ke toko taha ko ia ke ne mahu inga ia. Ko ene tui ko e mas. Ko ne whakaha ia tuia ene kindness mo ne respect. Ko ne whakapaapai o ne whemau ke malo. Ai kau ngā we. Pai whoki ki api hao mo malo no hono whamiri. Pa ko e taimi ko te tala noa iki ai. Ko ilo e fie toko taha ko ia. O ku te tokanga nge ke hene hao mo malo mo ne mo ilelei ai e api ngāwe. Pa e fie ai he ke loto mamahi e ko ilo e whamalo ia ko te alango o talange ke tui e mas mo ngai mea ko ia malo.
Alo.
Marobito ko e scenario raki. Ku tala noia whika kombo e koha kaunga ngāue o kune hanga whakaaluma i koe e taimo ke mui ai ki he tūtūni koe ape koe lao koe a ngāue anga kou ke ngāue ai. Ka koe whehui koe na mau whawhehuia ke te mau tolu koe hae mau mea e whai ke solova ake whainga palopare ma pehe. Pea rake o poini o ku mau diskasi o ku whemau ke te whakaha ke toko taha ko ia o ku iai e te duty of care. Pe ko e te responsibility ki he malu mo e hao ko ia ngawe anga. Pea ua ke poini ko e mahalo pe ko toko taha ko ni un e whai ko e whakaalo mau tiage ne ilo ki he lao ko ia e ngawe. Pakuton ko mea rewa kita ke te tokon ke toko taho ni, ko te aroma e standard operating procedure ke ne lau. Mahalo pun nakto ke ne taimu te ne lau ai te ne mahino i lewa. Pakapau te ne lau e standard procedure ko ia e ngawe anga, ka ke i whai ia ne unganga whaaluma mo e tonga pehe. Ko mere vai whai ko no escalate a problem ko ia, a paroparema ko ia. Pe ko e ku hanga o identified ko hae a parparema o ko pa te u escalate va a parparema ko ya aki hono whatalanoa ke supervisor whekak mo e natula pe ko urunganga to taha ko ni pe me ai e tok tila rewa supervisor e ngawe anga pa mo to taha ko ni pe aga pau e ikai ke lava e supervisor tila mo to taha ko ni pa ko final decision e whakahoko ia e manager. Pea me ai rewa, koe whaunga ia, ai koe whaunga ia te rā vai o tokon ke kakai koa o nau whaaluma i kita. Pea be maro.
Ok, malo, au pito, sai au pito ngai tari koe ne o kumo o mai. Pea o kumahino au pito pe me iai ai fie mau ke iai ha protocol, ha COVID protocol ke whai ai ha mui. So, before the person starts working in the facility, o statonu ke oange ki ai protocol ko ia. Ko me ai te ke ngawe, te ke follow ai. Ka pau ko toko taha koe ke ngawe, i he ngawe anga koe ni, ko pau ke follow he mea koe ni. Ole va ko ke fai pe en toonga pe he anga ko ngai me ko ni tala mai tala noa ki ai na koe ha uhinga lele koe ha uhinga me ko pe he ai ko ha me uhinga ko ke fitu ai ho mas na o ai hano fahinga whakautua ona o kai ke tau ilo e tau tolu ka hange ko lau taimeni tau vawe pe taimeni ke tau charge we're very judgmental at times talk hange ko mea kanu mo ko tu pe mo lau ki ai ki mo communication communicate talk to your customer what's the reason to your co-worker what's the reason oku ke pehe o ke fie tu ia e mask discuss sio ko mea nu toton ke tu ia e mask ko ke elo pe ko puke awia te ato mahati ka koe pate ke alko mo api to puke mo api ia so discussion and talk can sometimes solve the problem ka ka pau e kai hango mena formanat ma he grupo koe formanat ke a duty of care o koe your duty of care to him duty of care to your own family ke ne whakakaukau to whakaukau e hange mea koe ia pea ka pau lewa e kai pea hange koe protocols in the protocols you should have it there clear ka pau o kuai ha disagreement pe he I he kau ngā ue how do you escalate it who do you go to ka pau ko supervisor is your second line you go to your supervisor and from your supervisor it goes to your manager and it's out of your hand he time ko ia ka o te ke toi lau ko ai pa o te ke toi talanga ko ke kau ngā ap ke hoki friend ko ha moha me leave it ke supervisor or the manager and they will sort it out but it's very important that you have a protocol so that everybody e kau ngā we nau ilo protocol ko ia kai ke nau follow ki ai ko mea e hoko te nau sio ke supervisor te nau sio ke manager so it's very important that you have a protocol pe ka pau lewa pe ko hange ko te ka pau ko kita about te ngā au as a tourist guide ke te ilo ko ha mea te whai kai ai ha mea ha te disagreement with your customer or your client ai o kai ke pehe ko mea ata pe ai manager pe ko owner be aware when you go into a workplace be aware of what is the rules and regulation don ke eke ang ko ha mo and it's very important that you read that and now on this COVID-19 environment they should have something about preventative of COVID-19 and you read it and you should follow it and you know if you don't follow it it should be clear in there what the consequences are te hata te hane mea fie add on te hata te e kai no sai te tau whakaose aki pen we'll clean this table whakamanato e tau cleaning the surface manatu so we'll do we'll clean this table and we'll see who's cleaning the table the best okay. Who's going to be brave enough to do it? Anyone? This is our sanitizer, and this is our rag. Who's going to do it? I'm going to ask a brave person. Come on. How hataha? O kai ko hataha hine pe ia. O pau pe ko mea pe ka kai fifine. Ko mea ko kau pe ma ka kai tangata ia. So I'm going to Tony, you demonstrate. Okay, Tony, you're going to do it? Okay. Demonstrate a COVID cleaning. Oh.
Yeah, I would have a rag and I would
Yeah,
have
and the
spray.
sanitizer. Okay.
And I'm going to spray all over the table.
Mm-hmm.
Over in the middle.
Yeah.
And then I would start in the middle.
Mm-hmm.
Like that. Working out, working out, working out, working out. Now it's a round table, so it's okay. I do it as a round table. Or if it was a square table, I was doing 10.
Okay.
And that's just forward again. And that's about all I would do first.
Okay, thank you, Tony. And then what do you do with the rag,
I throw
Tony?
the rag in the rubbish bin.
Yeah, if you need to reuse it again?
If I'm going to use it again, I'm going to wash it.
Yeah, okay, good.
And the spray, I'm going to wipe it down after I finish with some detergent.
Okay, all right, okay. Thank you. Give a clap of hand, give a big hand to Tony. Okay, all right. Next person. Okay. We'll just do it a couple more, and then we'll have a discussion afterwards. Eh? So just write down some points as we go along, and then we'll discuss it afterwards. Can do it? Use another rag there.
Loloang and no for I disinfected him at the Ukok Kiulahi, and then I'll start with the Ukok OCC. Firma que matou.
Okay, malo. Okay, next person. Hanta brave enough to do it from this table, girls? Just write some notes in what you think, something that you pick up. Don't worry, if you make mistake, it's okay. Okay, okay. Oh, well. How? Tu he ta coi cái asli lagi. Coi ô nai ita ma phụ lai anh square. Okay. Okay, good. Okay. Coi Debilen coi, dapat Debilen là isi Frau sie. Somebody from here? Come on. Come on, girl. Okay, sometimes you need to actually, sorry. Actually do it, so that you're conscious of what you're doing. Okay, all right. Okay, good. Thank you. Very fast and nice, yeah. Makanya ngi puhang pakai terbiar ni ay. Kau ya. Okay, okay, good. Sai. Na mo is ay mo modol? Te pila modolo? Oh, you're the last one. Come on, someone from your table. Kaya ang hipo kita ha. No? Oh, use a paper towel. Fe tau paper. A paper towel in it. Oh yeah, we might own that now. Oh, see in the mirror. Sai, Paspasi. Okay. Sai, Alfredo. Sai. Tau ki sio lewa ki ngai mea ko na tau sio ki ai. Te mape ke mo throw in something that you pick that it wasn't right, O ai pehe ko ai ko ni you're not to kuhi for ataki lalo, ka ko ai for a point of discussion ke tau ta no ki ai mea lele. E tau tana noa ki ai, e tau sio pe ki ai, Okay, kaya ta ne pick up ha mea? Iyo? Okay, I go make concern ki ai, I own a go business, in the ways, just make sure, as long as it's wet, ko hike ke ngā wea. Not too much, ke hui e tawhi aki pia kai la mai o nā ia ko waste waste the money, so just bear in mind just enough ke whaionga just to cover the surface, o kai ke ai o whakatupu I taia ke o nā, so anything else? Did anybody pick up? Iyo?
Tahu aku tapi ngahi demonstrate mai kau kiri na, kau kan ni ihi kau foi spray ni, kau ihu fana. Epe mau peke mama, fata hate maa te ngawe anga mo te safety kau kita. Kai kau bala ni apa mai ai. Kau ia kau kita hana kia tu.
Okay, thank you. Iyo mo ni aupito, Just make sure you just stand and you spray, O ke o te ke fuofi ke aluha ke a chemical ia ke a koe o ke manawa ake, Pea mo just make sure kai ke puno o tau hovala ko ia I te pire ko ke hanga ko o whakamaa, Anything else that anybody can pick up? Anybody else? No? Okay, a couple of things. Koe, nā whakatoka ngai pe, o kei pe whahinga, o kei go over the same area. Eh? Make sure when you do it, o kai ke, when you do it, you just go one area once. Eh? O osi. Eh? O te ke eh? Just one, make sure, just be conscious. Eh? For circle, for alu, to tahape, you go baos. Eh? Owe, make sure pe ko fulu o ma, eh? O kai tapi pe ko o lunga kai ke me ape, eh? And if that happens, fe tong ya ho reg pe ko ai ma ho paper towel le ta o ke nga we ak, eh? Ko me ta te cái đồng hồ cái cái mỗi ngày cả quay cái lo có hai mẹ lại mỗi ngày của á tôi ăn có ai tôi ăn ở cái mỗi ngày cả tôi ăn tôi kia đấy mà tôi cái còn gì xí bao cái phải cái này you got sanitizers there, sanitize your hand before you continue on your work. I think that will do. They have to discuss that.
Para pau que i fa que pete pile, pa te fuli ki ha que pe ta fa to ma a ke ko ta uri o to e. Te vai a.
When the moist area, I go for I think you go I see a more.
You dry up the pile, get away moist. It's not just you see mo ka rabbit. But my question is, how long ago can you go with me and now after the fact of my bread, get the dry up the area?
I wouldn't recommend que te estoy dejando que está fluida que está que kapau has sanitizer, it will most probably dry up very quickly with alcohol. Kapau ha soap and water, it will probably be just a little bit longer to dry up. I would recommend you get another piece of paper or a rag if it's really wet. If it's really wet, get another rag or dry it.
Because how I do my cleaning, or to get a rag, all I can do but to get a rag from my cooker.
I wouldn't recommend it to have your if it's a paper towel you're using, use another paper towel to dry if it's too. If it's a rag, get another one. Or you have two rags, one is a wet one and one is a dry one. I wouldn't recommend if it's a hangape or you don't know. It can. You don't know whether the whatever you're picking up can travel up to whatever you thought it was clean. So I wouldn't recommend it. And I was.
We were doing it because we were doing it.
I wouldn't recommend using the same rag. A different rag?
Accommodation. The industry.
Depending on the material? Yes. Is it? Depending on the material you use? Okay.
What I'm saying, I'm talking from experience. I will get a record and follow up with first clean, but I will get a red mark.
Yeah, okay.
But not one way. Definitely not.
I was going to talk about that when you were folding it over, and I forgot it. Ka ku sai taha pe ke ngau a ke rag ke pe, or don't use the same rag. Huh? And if you're using paper towel, it's better discard the one that you first used and use another towel to dry it up. But thank you. That's good because you reminded me. No, that's okay.
No, what I'm saying, I just wanted to clarify, not all scenario is more, it seems to be because of what they do.
And that's what it depends on material. That's what she's saying. Ngahi facility and depending on the material that they're using, that you can use the other side. What? You still, yes. You definitely just use two different rags. If it's too wet, you've got a dry one, and you use that one. Don't pelukia ketavaketaha or dry it. And make sure you don't go twice over the same area. That's the main thing as well. Or to get I do over. If you add on hataha, feel free. Or the mo student, if there's anything you want to ask. Or motoko na ngawe or ngawe. You want to comment? Feel free to say it. Okay. If not, I think we are. What time is it? I think we can. Let me have a look there. Where we are. Okay, I think that will do for now. We'll just wait for our lunch, and then we'll do another. We'll do COVID planning protocols afterwards. Okay, so we can go outside, have a chat among yourselves, have some fresh air. Okay. Okay, guys, you all right here? Okay.